Just to mention a little about different methods. So in radiography, X-ray modality, we have of course terminology based on opacity and lucency. So radiopaque, radiolucent areas can be described. We can use the contrast medium, which is mostly iodine. Of course, we are using the radiation, and the most the main contraindication is pregnancy. For some methods. CT, of course, we can use the density or attenuation for describing the areas. We are using as well the iodine contrast medium. We are using the radiation, and of course, some problems or contraindication can be seen. So the renal impairment and pregnancy can be relative contraindication. MRI, as we mentioned before, we have intensity of the signal to describe the different areas. So hyper or hypo-intense areas we can have. Contrast medium is a gadolinium. We are not using the radiation, and some metal electronics, and of course claustrophobia can cause some problems. Ultrasound examination is based on the echogenicity of the tissues. We are using mostly the microbubbles, so-called air contrast medium. We are not using the radiation, and of course body habitus and sometimes operator skill can be a problem. We are starting with the computer tomography. CT scanners use X-rays to produce computer-generated tomograph sectional or slice images. In CT, the radiographic film is replaced by very sensitive crystal or gas detectors. The detectors measure the intensity of the X-ray beam emerging from the patient and convert this into digital data, which are stored and can be manipulated by the computer. And of course, this numerical information is converted into the grayscale representing different tissue densities. And the most important thing to remember is that the more dense a tissue, the more X-ray it absorbs. Bone X-rays are absorbed, and a few X-rays reaching the detector that can look as a white area. So bone in a CT is a white. Air X-rays are not absorbed. Lots of X-rays reaching the detector, and it can visualize as a black area. Compared to plain film, CT is able to distinguish more subtle density differences, and there is no overlapping of the structures. The CT scanner is a large square piece of equipment with a central circular hole. The patient lays down with the part of the body to be examined with this circular hole. Currently, CT machines use spiral CT. The tube head and detectors moves into a continuous spiral motion around the patient as the patient moves continuously into the gantry, layer after layer. As the tube head rotates around the patient, the detectors produce penetration profile of the slice of the body being examined. Okay, and this is the example of the examination of CT. So you can see the patient moves directly into the machine, layer after layer, and the X-ray source and the detectors are circulating over his body. Okay. Instead of film, radiation detectors measure the radiation attenuation as the beam passes through the body. The detectors are connected to a computer that uses algorithms to process the data into useful images that are then recorded on film and viewed on a computer monitor. Windowing, so we have a Hounsfield units to describe the CT, and as you remember, we have different colors of the different tissues. So the more dense the tissue is, the more white it is. It's showing as a more white. So here we have up around 2,000+ Hounsfield units. Here we have the bony structures, calculus, teeth, of course, and the metal equipment. Around 0, here we have a water, and the most black areas are airy areas. Okay. Here we have the examples of commonly used windows, and here we have the soft tissue window, lung tissue window, and as you remember, we have also the bone tissue window, bony window. Of course, the artifacts can complicate our interpretation. For example, metals usually seen as radiating bright streaks, sternotomy wires, aneurysm clips, dental fillings as the amalgam or composite fillings. High concentration of fourth contrast, arm veins, heart, motion minimized by asking patient to hold their breath, of course, can be a problem, the motion of the patient. Main indication, just to quick memorizing: investigation of intracranial disease, including tumors, hemorrhage, and infarct. Investigation of suspected intracranial and spinal cord damage following trauma of the head and neck. Assessment of fractures, tumor staging, of course. Assessment of the site size and extent of tumors, both benign and malignant. Sometimes we can investigate osteomyelitis, investigation of TMJ, preoperative assessment of maxillary and mandibular alveolar bone height and thickness before inserting the implants. Okay, we will skip the advantages because we talked about it on the first lecture, disadvantages as well. Okay, and let's focus on the anatomy. Of course, this is our soft tissue window because the bony structure are too much in contrast, so they are not so clearly visible. This is bony structure or bony window, which can be really similar to CBCT imaging. And of course, here we have our coronal or frontal view. Here we have the sinuses, maxillary sinuses, orbits. Here we have a frontal bone. Of course, the nasal septum, nasal inferior conhine here. This is the medial or medium nasal concha. Here, left side, right side. Here we have the maxillary part, and here we have the mandibulary part of maxillofacial region. Here we have, of course, the hyoid bone in the middle of the patient. This is the axial view. And we can see some parts of the upper teeth. So here we have the incisive foramen, incisive foramen. Here we have a middle suture of hard palate. This is, of course, the both sides of the hard palate. Here we have our maxillary sinuses. Here we have the lateral pterygoid plate, which is really important to assess during the examination, especially in patients which have a trauma or really big car accidents, because the lateral pterygoid plate is usually involved with the fractures of the maxillofacial region. Then what we have more? Here we have, of course, the mandibular ramus. This is not a zygomatic arch, which is really hard for you to memorize. So this is the anterior, this is the ramus of the mandible. The zygomatic arch will be a little bit more lateral placed. Okay, then here we have, of course, the nasal spine, anterior nasal spine in here. What more? Maybe let's skip to the second picture. This is, of course, our process. Okay, this is as well the mandibular ramus. Here, some parts of the teeth, upper teeth, and a little bit more part of the maxillary sinuses. Okay, let's skip to the mandibular part. So this is, of course, mandible. This is both sides, the mandibular ramus. This is our spine. Those are, of course, mandibular teeth. We can see the anatomy, which is different teeth anatomy, different in comparison with upper molars, especially. This is really important clue for you to differentiate those teeth. What else more? Here we have the part of the mandibular canal, which will be more visible in sagittal views. Here we have, of course, our mental foramen, both sides. Okay, and let's skip to CBCT anatomy. About some basics in the physics. So we talked about it on the first lecture, so we will skip those slides. As you remember, we have a flat fan-shaped beam in a CT, and here we have a cone-shaped X-ray beam in a CBCT. Okay, different field of views we can use, small, medium, and a large. Mostly the small field of view is used. And those are the differences. 5 up to 5, sometimes 5 up to 8, and this is the 15 up to 15. Okay, and those are different images which can be seen in the CBCT post-process program. Those are, of course, transsectionals here and here. This is the part of the small field of view with, of course, axial view. Okay. Here we have again axial, coronal, or frontal and the sagittal section. Okay, one more time. And this is the CBCT view of the molar. Here we have, of course, the crown, the roots, and the part which is called the cervix or cemental enamel junction here. The enamel is more dense structure as it in comparison with a dentin. Here we have the pulp chamber, pulp in the roots, and of course the cementum. Okay, this is the conventional 2D radiography. And this is the CBCT of the same tooth. As you can see, something's going wrong, and we can see it only on a CBCT views. So this looks quite normal. Okay, this is 2D reconstruction, of course. This is 3D reconstruction, and those are different planes. And you can see that the implant planning is has begun. We can measure the width and the length of the bony part to place the right size of the implant. Okay, indications. So, for example, localization of unerupted tooth, assessment of external resorption in relation to unerupted teeth, localized assessment of an impacted tooth, assessment of cleft palate, planning complex orthodontic surgical management of maxillofacial skeletal abnormalities. So those are, of course, things that we mentioned on the first lecture. Advantages we will skip and disadvantages as well. This is, again, a small field of view of actual image. Here we have the image of upper teeth, of course. This is the coronal here, and this is the sagittal. Okay, nasal septum, left, right maxillary sinuses, the area of the pharynx, of course. This is the occipital bone here. This is the mastoid ursus. Here we have the ramus of the mandible. This is the zygomatic arch or zygomatic process, maxillary process. This is the sagittal view. We can see the sphenoid sinus, quite good. The clivus, the salatoxica. We can see some pathological pineal calcification. Here we have the soft tissue uvula, of course, hard palate, part of the hyoid bone, epiglottis, and the airways. This is, of course, again, axial, part of the frontal view, part of our frontal view again. This is the mandible, this is the mental foramen here. Here we have the mandibular canal. This is, of course, the sagittal view. Different transsectionals. Mental foramen here. And again. Okay, we've seen this slide before. This is the small field of view of the left part of the patient, right part of the patient. This is, of course, the mastoid process with the mastoid air cells with inside. Okay, some pathological structures, soft tissue masses in the sinuses. Okay. Different layers of the patient. I hope that on your classes you were able to assess or to examine the patient. As you can see, there is a problem with the permanent upper canines. Okay, let's skip. This is not so important for you. Of course, this is the nasal septum, nasal concha, inferior this time. This is the medial inferior concha, medial nasal concha, sorry. Okay, this is quite easy, I guess. This is the 3D reconstruction. Okay, MRI. Again, we are not using the radiation. Okay, T1, T2. Let's talk about maybe FLAIR imaging. So this is fluid attenuated inversion recovery, and it looks like T2 imaging, but water is dark. This is the most important thing to remember. Okay, indications we know, advantages, disadvantages as well. This is the picture we discussed earlier, again. Okay, the same. A few words about ultrasound. Reflecting biosolid and gas the structures are bright, and of course, dark will be absorbed by the fluid. Okay, here we have the mandible, and we can see the acoustic shadow. So our bony structure will not be visible, quite good visible in a ultrasound examination. Here we have some different muscles. This is the anterior belly of the gastric muscle, and this is the area which sometimes radiologists call the Mickey Mouse. It has some ears, face, so this is really characteristic. And I think that this is all. So don't worry about anatomics in MRI and ultrasound. This is really, really hard to investigate it and to recognize different structures. Of course, you have to be like really, really good at this and have years and years in radiology to be a good operator on ultrasound examination. So don't worry, we will learn a little bit more next year or year, I hope. Okay, so please turn off your cameras. We will take a screenshot at the end of the lectures. Okay. Okay, thank you. You can turn off your cameras.